What if there was a really simple tool that you could use to knock out nasty, annoying pains when they pop up? That is what we're going to talk about today in this video. I am using BFR cuffs to take care of some annoying anterior front of the knee pain that just happened to me. This is something that you can do all the time and it works like a charm. So we get asked all the time, how do I take care of these annoying issues when they pop up? I'm not talking about the things that are rather severe, like, oh, you fell, you heard a pop, and now you can't walk. That's not what this is about. This is more about those annoying things that pop up on the front of your knee, the annoying things that pop up when you're trying to work out, when you're at home, you've been sitting all day and you stand up and oh, your knees really hurt. And then sometimes they can last a long time. These can still be annoying injuries or annoying nagging issues that have gone on for months, maybe years, and you don't know what to do with it. There is a tool. This is blood flow restriction training. These are the Saga blood flow restriction cuffs that we use all the time. These cuffs are amazing for taking care of these issues. 9 out of 10 patients that we see when we use these for an issue like this, the pain's gone that day. These have a great analgesic effect because they do some amazing things that we're gonna get into. If you've watched this channel before, you know we love blood flow restriction training. I'm gonna give you a tidbit as to why today to take out this nasty knee pain. So the first thing I'm gonna do is I'm gonna get my cuffs turned on here so you can see, you can probably hear that air compressor go off. There it is, so the cuffs are pumping up. I've got my cuffs set for 80% right now. So the magic about these blood flow restriction cuffs and why they work so well to knock out pain, specifically pain when you have a nagging injury like this, when you're talking about rehab, when you're talking about trying to heal a bodily area, you are talking about type 2 muscle fibers. Those are your power fibers. When you think of a sprinter, when you think of somebody who's very powerful, a long jumper, those are the type of muscle fibers you're utilizing. Type 1 fibers are gonna be your marathon runners, your long distance athletes, your cross country skiers. Those are more type 1. When we're doing rehab, we wanna focus entirely on type 2. So I've got the cuffs inflated. This is for that nasty knee injury that you're dealing with on the front of the knee. This is super simple. You can do this while you're talking to people, watching TV, whatever. You're just gonna take a loop band, you're gonna hold one leg down, and the other one, you're gonna kick up. And that's gonna fire your quad. Each time you do this, you're trying to lock the knee out, you're gonna give me a 2-second hold at the top. The rep scheme you're gonna use for everything on this is a very simple rep scheme. It's not gonna feel simple. This is definitely hard, but it's 30 reps with a 2-second isometric, and then you have about a 30-second rest between sets, and then you'll do 3 sets of 15. So overall, it's 75 reps. It's a lot of reps, but like I said, most of the time people walk away from this feeling great with their pain levels dropping 3 to 4 points on the pain scale or entirely dissipating, and that's the effect we want. So you're gonna start here, we're gonna hit our 30 reps, and then after these, if you still have pain, so after you finish these, you're gonna hop up, you're gonna deflate your cuffs, you're gonna say, oh, how am I feeling? I'm feeling better now. Maybe that's all you need. If you need more, I have 2 other movements that you're gonna do, and they're both really simple. Next movement is you're gonna use something for balance if you need to, and we're simply gonna do a little bit of a knee pulse. So here, I'm gonna let the knee go forward, now I'm gonna come back up. Let the knee go forward, and I'm gonna come back up. So to see that from the side, I'm here, knee is forward, knees back up. I have my body weight over the leg that's affected. If this is the knee that hurts, then you're doing it with that leg in front. If it's the other knee, you do the other leg in front. Okay? Same rep scheme still, 30 reps and then 3 sets of 15 between. You want your cuffs at about 80% occlusion. The Saga app that they have takes care of all that for you. You just you get fitted for them, and then after it's fitted, it'll give you your occlusion pressure. If 80% is a little rough, you can back it down to 60%, just a little tip for you. And the final thing, the final movement I want you to do, if you look and you still have pain, we're gonna keep this super, super simple. You can grab something for balance if you need to. I want you to give me a squat. Obviously, we would love if you are going to go to a full depth squat because you're taking that knee through a full range of motion. It's getting fully lubricated through the entirety of the joint. But if not, it's totally fine to simply do some partial squats just to work the knee. And this should be a little easier than the other ones because you're using both legs. Everything else is just single leg. So I'm gonna deflate these so I can get a little relief because it's kind of brutal. But those are 3 exercises that you can do to try to take out nagging lower extremity issues. We did this video for the front of the knee because that's such a hot spot. If you really do anything, whether you're a desk worker, whether you're working at home, maybe you're a runner, maybe you're a lifter, the front of the knee tends to always pop up. but this is good for anything below the cuffs, knees, ankles, you name it. If you want to get the upper body cuff, you can use this for lateral epicondylitis, medial epicondylitis, any type of elbow or wrist injury. These are great for that. So give these a shot. If you have any questions, let us know in the comments or send us a message and we'll try to get back with you. We actually sell these cuffs in our clinic. You can buy these online. We have a referral code. We will put that down in the description. I think you get 20% off if you get the Saga cuffs through us. So you can get a 20% off deal. I think the cuffs will be under $300 that way. They're normally over $300. So it's a pretty good deal. But yeah, check this out. If you like this video, if it helps, let us know in the comments, but also like it, subscribe, and ring the bell so you never miss out on any of these opportunities to get healthier. We'll see you guys later.